Paul has been in hospital following surgery. The doctors have said that he's well enough to leave the hospital, but Paul will require further care and support in his home. Although Paul wants to go home, it's proving difficult to get the support that he will need put in place quickly. Edith has been waiting on a trolley in the emergency department for 6 hours with a suspected broken hip. She's tired and in pain. She needs to be admitted for surgery, but there are currently no beds available on the ward. The longer Edith waits, the more risks there are to her health. The nurse tells Paul that he can go to a care home while he waits on the support that he requires, which could take some time to arrange. Paul isn't sure about it, as he's worried about the cost, but he doesn't want to stay in hospital any longer. Edith has now been waiting 10 hours, and the emergency department is getting more and more busy. His physiotherapist explains to Paul and his family that if he chooses the temporary stay in a care home, the Health and Social Care Trust will pay for his care until he can go home. His travel will also be arranged to take him to the care home. She explains that if Paul stays in the hospital bed for longer, he could pick up infections from other patients or lose muscle tone, which could reduce his independence at home. As Paul decides to leave the hospital for the care home, Edith is being prepared for admission to the ward. When patients who are well enough to be discharged from hospital consider all of the options available to them, it can really help us offer better care to everyone. We will work with you, your family or carer in planning your discharge within 48 hours of a doctor saying you no longer need to be in hospital. We want to move our patients through the hospital system as safely and effectively as possible, in the most compassionate way. We really appreciate the cooperation of our patients and families working with us to improve the flow of patients through our hospitals.